Now, we were just talking with Brandon Lewis, among other things, about the campaign for the footballer Marcus Rashford to get the government to provide free school meals to the poorest children over half-term and other school holidays as well. This week, MPs voted against doing that, but Labour wants there to be another vote. We're joined now by the Shadow Mental Health Minister, Dr. Rosena Allin-Khan. Thank you very much for being with us.
Thank you for having me.
So you're going to be pushing for another vote on this. What's the plan?
Absolutely. The Labour Party are not going to give up on our young people, on the children who are going to bed hungry. And the fact that 322 MPs made the morally reprehensible decision to vote against free school meals this week is deeply saddening. But I will say that what has played out over the ensuing days is the very best of what it means to be British. Our communities have stood up to this government and said, we don't care what you have done. We are angry and we are going to take matters into our own hands. And so we have seen, local restaurants, communities, councils stepping up, even though so many themselves have been hit so hard by this COVID crisis, and providing support for children and young people. And it makes me so proud to be British. And I know that Marcus Rashford and his campaign absolutely represents the best of our country.
When do you think that vote might happen then, do you know?
Well, we are honestly hoping that the Conservative government dig deep and look introspectively and perform a U-turn on this. But we certainly will be pushing for a vote before Christmas.
OK. I'm keen to talk to you about another story that's emerged on the programme today as well. We heard from Bella Jenkins at the beginning of the show calling on Dido Harding, the head of Test and Trace, to go. Do you think it's time for new leadership there?
Look, it's very interesting. I think the huge take-home message here is that the Tories are infighting because even they themselves can see just how catastrophic the handling of our test, trace and isolate system has been.
I mean, should she go then? Do you think it's time for her to go?
Well, actually, I think the real message is about the people who are needing this to work for them. We are seeing Serco lining the pockets of shareholders with £165 million of profit, but not delivering the contact tracing. We have been calling for, as Labour Party, for it to be in the hands of local public health teams who have been delivering a contact tracing rate of 97.1%, whereas Serco, if they're lucky, get 68.1%. It's time to put it back to the local communities that know their communities the best.
So new leadership, then?
Her position is very difficult. It's untenable, really. But fundamentally, this comes down to the responsibility of the government. They have failed people. And there are people who are going into this Christmas period not knowing whether they're going to be able to hug their elderly parent in a care home for the last time or not. We need to be speaking up for them. And for that, we need to put it back into the hands of our local public health teams.
Now, I'm keen to talk to you about Labour's own plan. You want to see the circuit breaker, a sort of short, sharp lockdown to try and drive down cases. So what I want to know about is the exit strategy. Would that be time limited or would you be driven by the data?
So we are calling for a short 2 to 3 week circuit breaker because we believe that ultimately, based on sage advice, it would save lives and be most protective to our economy.
I understand why you're calling for it. What I'm trying to work out is what is the exit strategy? Would it last for a certain amount of time, no matter what happens, or would you be driven by the data?
No, it would last for a certain amount of time, no matter what happens, and then we would go back into the tiered system. OK, I just want to have a look at what Keir Starmer said at Prime Minister's Questions this week. He said this to the Prime Minister. He said, is the Prime Minister seriously saying he would take a Tier 3 area out of Tier 3 with the R rate above 1? I don't think so. Now, are you seriously saying that you would end a circuit breaker lockdown if the R remains above 1? Because I don't think you'd do that either. We're very clear that the circuit breaker would be for a prescribed period of time. It would not be for a protracted period of time. Fundamentally, this circuit breaker is needed in order to get on top of the shambolic test, trace and isolate system. If we are able to get on top of that, it will protect our economy. And
but if you're not,
said,
and if the R rate remains above 1, you're saying that you would just lift the restrictions, even though Keir Starmer doesn't believe Boris Johnson when he says the same thing.
We're very clear that the circuit breaker would be for a 2 to 3 week period only. And even the IMF has said that if the government don't take that advice and don't act and do that now, I mean, look, we wanted it now over the half-term period when it would cause the least disruption to people, but it could cost our economy £110 billion. The government have been asleep at the wheel. They have to act.
OK. I'm keen to ask about another story around today. We asked Brandon Lewis about it too, about these reports that the government is looking at bringing down the self-isolation period from 2 weeks to potentially 10 days or even 7 days. Do you think that's a good idea?
I've always been very clear from the start of this pandemic, especially with my work on the front line, how important it is that we follow the science and we follow the World Health Organization advice on how long we should be self-isolating. This is in order to protect ourselves, our families, but also, more importantly, everybody else around us. And the British public have been incredible. They have shown such resolve. This has been going on for 7 months now, and the British public are tired and they need hope. But it is essential that we only do what is safe. And fundamentally, it all comes back down to getting on top of test, trace and isolate, because if the government were able to do that, then people would have some certainty. And there is nothing to say that if they brought down the period to 7 days, that people then wouldn't go out after 3 days.
So actually you don't think it would have an impact on compliance anyway?
I think people are tired. People are tired and they need hope. And they're going into a long, dark winter. We know that in the first phase of COVID, when we had the first peak, the ONS figures showed that depression rates just skyrocketed. And we have to understand that people have been doing their best. The majority of the public have been doing their best. And I'm really proud of the public. I'm really proud of the British people who are putting other people's safety first as well as their own.
You're talking about depression rates, about the long, dark winter. It's so many of our viewers will be feeling pretty down, let's be frank, about the months to come. Lockdown, self-isolation, social distancing all taking its toll. How concerned are you by reports that referrals to mental health services have actually been dropping?
I'm deeply concerned because I know that is not reflective of what we are seeing at large. And I would just like to take this opportunity to say that the NHS are working incredibly hard. They are doing their best. And actually, like, mental ill health doesn't discriminate. It doesn't know class, it doesn't know gender or ethnicity. And so many people have really been struggling with their mental health, particularly our frontline NHS and care workers, which is why Labour called for a Care for Carers package to put their mental health first. We know that in June alone, 32% of sickness days in the NHS was down to mental ill health. I've raised this with the government, that was more sickness days due to mental ill health than to the coronavirus itself. But the government just haven't been listening. The government need to have a plan in place, a mental health and wellbeing strategy going into this winter. That is what the Labour Party is calling for. They have to be gathering data, they need to be understanding where the pressures are, and they need to be delivering for the people that need it the most.
Isn't the problem, though, that for many people, the reason they're suffering from mental ill health is because they can't see people. They can't see their loved ones, they can't see their families. And does that not need to be taken into account as well when we're thinking about imposing restrictions on people?
It needs to be taken into account when we're looking at the fact that test, trace and isolate has failed people, because if we'd have got on top of that, it would have been so much easier for people to be able to see their families.
I understand why your criticism is of test, trace and isolate, but even if you look at someone like Germany, for example, whose test, trace and isolate system has been praised, their R rate is about the same as ours. Cases are going up. You can't blame the whole thing on test, trace and isolate. Do we not need to have a wider conversation about the impact that restrictions are having on people's mental health?
You're absolutely correct. There are people in some parts of the country who've pretty much been in lockdown since March. This government haven't managed to actually get on top of the virus during that time, which is why we're calling for a short 2 to 3 week circuit breaker to get on top of the virus, to drive the R number down and to give the government a chance to fix, test, trace and isolate. And we want to work with the government to make this happen. It's in all of our interests. But the British people are incredible and they need hope, and they need to know that they will get out the other side. We will get to next year and things will get better, but we just have to hold on to that hope and know that the government are doing all they can to protect our mental health.
And just finally, you've recently been fined £1,000, just over £1,000, for breaching House of Commons rules after you sent out letters saying that you were fighting Brexit on House of Commons header paper, prepaid envelopes during the election campaign. Now, this is the third time you've breached the rules in 3 years. Are you becoming a bit of a serial offender here?
No, look, the rules are important and they are there to be followed. The first time I broke the rules was because on paper that I paid for myself, I used a picture of a crown portcullis. I made a mistake. I didn't realise that was an issue.
But you've made a mistake 3 times now.
I declared my NHS payment for my shift a little bit late, and I used paper to respond to people who'd written to me about Brexit. I did it in good faith. I held up my hands and said, I'm sorry, I made a mistake. I'm human, I'm not a career politician, but rules are there to be followed. And actually, when I realised that I'd made a mistake, I straight away offered to repay the cost of the stationery. And yeah, I'm sorry, and I hold my hands up.